Good evening, everyone, and thank you for joining us tonight for Illinois Bone and Joint Institute's 54th virtual YMCA Education Series program with the North Suburban YMCA. My name is Karen Brownlee, and I'm a personal trainer and the adult program coordinator at the NSYMCA in Northbrook, Illinois. This evening's presentation, entitled Telehealth, Rehab Revolutionized, Physical and Occupational Therapy in the Digital World, is being recorded so that you will be able to revisit it again. Please feel free to tell your family and friends about it so that they too can view it once it is posted on the IBJI and NSYMCA websites. According to a YouGov poll of more than 1,000 Americans in March of this year, 51% indicated that at some point in their lives, they have received care from a physical therapist. A few of the benefits of physical therapy include pain management, improving mobility and balance, injury and fall prevention, avoiding or delaying surgery, improving outcomes after surgery, returning to activity following a surgery, improving quality of life, and so much more. Tonight, physical therapist Regina Roderick will talk with us about physical and occupational therapy in the digital world. Over the past decade, telehealth has surged, reshaping the landscape of healthcare delivery, and IBJI is harnessing telehealth to revolutionize access to physical therapy care and elevate patient outcomes. Tonight, Regina will dive into the realm of innovative therapy advancements, help us discover and understand the transformative potential of digital physical and occupational therapy, and explore cutting-edge developments poised to redefine the journey towards wellness. With more than 20 years practicing as a physical therapist, Regina brings both experience and expertise to tonight's discussion. She holds a master's in physical therapy from Washington University in St. Louis, and in addition to being a licensed physical therapist, she is also the facility manager at the Chicago Park Ridge IBJI office. Regina's primary area of practice is outpatient orthopedics, where she focuses on integrating posture and alignment throughout the body systems for symptom management and overall health. Her particular areas of interest are geriatrics, joint replacement, pelvic floor therapy, and incorporating digital platforms in patient care to improve access and outcomes for patients. During Regina's presentation this evening, you might find that you have questions for her, which she will be happy to address at the end of the program. Simply type your questions into the questions section on your screen, and I will receive them and relay them to Regina immediately following her presentation. I do ask that you please keep your questions general, as she will not be able to address individual concerns without individual consultation. If you do have self-specific questions, please contact Regina via one of the options that will be listed on the slide shown during the question and answer portion of the program at the end of her presentation. One last thing before I turn the evening over to Regina, please mark your calendar for our next IBJI and YMCA Education Series program on Wednesday, August 28th at 7 p.m. Dr. Jason Schroeder-Henry will discuss unveiling solutions for a pain-free elbow, diagnosis, treatment, and beyond. Thank you again for joining us tonight, and thank you to physical therapist Regina Roderick for your time and effort in putting together this program to help us learn and understand telehealth, Rehab Revolutionized, physical and occupational therapy in the digital world. Regina, please take it from here.
Great, thank you for that lovely introduction. Okay, well, thank you everyone for joining us. I'm really, really pleased to be able to be here and share this information with you all. I think Karen gave me a wonderful, wonderful introduction, but telehealth has been something I've been focusing on now for at least 4 years. And so I'm really, really excited to bring some of the things that we've learned and some of the things that we're putting into practice at IBJI out to you all in the community. So what is telehealth physical therapy? That's one of the first questions we get when I tell people that this is what I'm working on. The definition of telehealth physical therapy is that delivery of health services and information through telecommunications. That means you can get care without leaving your home, which is one of the great benefits of this program. You can have an appointment via the computer. You can have an appointment via the phone. And then we also have some apps that we are using and developing at IBJI that help get information to you and help deliver your care plans to you, and also can give you another point of contact or ways to contact your therapist in between your appointment times. What can telehealth therapy do for you? One of the biggest things that we can do for you is education and advice. One of the things about a telehealth physical therapy appointment is that you are pretty much one-on-one for that entire time with your provider. That gives your provider a lot of time to go through any questions you have, help give you information about your diagnosis, your care plan, your symptom management, and advice on how to incorporate any of those things in your daily life. You can get reminders. The app is one of the great ways that we can remind you to participate in your home exercise program, or check up on you if we notice that you're not able to participate in your home exercise program. We can monitor your health through different ways that we communicate with you via the app or even on a computer or telephone appointment. And we can also give you treatments directly through any of those mediums for you to work on at home. So we try to incorporate all of these things through all the different platforms to be able to reach you in your home and more in your daily life, and not just within the walls of the clinic. So another question, telehealth, is it really effective? There have been more and more studies coming out in the last few years, especially as telehealth has gained in importance and prevalence in the healthcare system. One of the most recent studies, which was completed in 2020, compared the outcomes for patients who go through what we would consider traditional rehab or in-person appointments versus just using virtual therapy and an app. And they found that the patients that went through and did the telehealth program had fewer rehospitalizations than the traditional rehab group. They had increased participation in their physical therapy activities throughout their course of rehab. The knee bending motion improved by 3 degrees over the traditional rehab group. And this one I love, less pain on average at the 12-week post-op appointment than the patients that did traditional in-person physical therapy. So this is a really powerful study that showed that telehealth physical therapy can really have some positive effects that are as good or better than what we consider traditional physical therapy, which is completed only within the 4 walls of a clinic. Now, this is another important question. Telehealth and physical therapy, is it for me? Is this a medium that's going to work well for me? Some things that we ask you to think about and that you might have to feel comfortable with is, first of all, feeling comfortable with a certain level of comfort with technology, meaning being able to navigate a laptop or a phone, because most of the time that's going to be how you connect with your provider. Do you need more ability to access therapy from different locations? Some of us have busy schedules, be it with work, be it with family, be it with any other demands on our time. Telehealth can often allow you to get an appointment in without the travel to a clinic from the comfort of your own home. So it's easier to maybe integrate that in the day versus going out and receiving care within a clinic. Again, access and flexibility. Oftentimes we have providers that may have some different schedules that allow for appointments that may happen outside of the traditional in-person therapy clinic locations. One of the other things that's great is that it can extend your care. Some of what we're doing with telehealth is not that we're replacing in-person visits completely, but that we're using these platforms to then allow for your continuity of care to extend past those traditional visits where you're going into the clinic. So we have an app that we use with some of our patients. This allows the patients to message me or whoever their care provider is in between their sessions. It will come to me on my computer screen, and I can send a message back within 5 to 10 minutes of receiving your message based on how busy their therapist is at work. But it does allow for you to have a touch point, a person that you can connect with in between your appointments. And then often I will utilize this app with my patients to have them continue to feel like they've got someone to check in with, even when they're done with their traditional in-person visits. So this is a really great way that we can take the care that you have received within the four walls of the clinic and allow you to bring it with you into your daily life and even beyond when you're working one-on-one with your physical therapist. I put this up here. This is just an example of a message I shared with a patient of mine earlier this week who wanted to talk about what they were previously doing in their earlier sessions and how we could incorporate that all into one exercise program now that he was working with me and was later on in the process of rehabbing from a total knee replacement. So very convenient. He sent me a couple of questions about the exercises he was doing. And then I said, wonderful. I incorporated it into the program, put it on the app for him. And then now it was all pulled together. So it was very, very easy for him to find the exercises and then start to incorporate those all together as he was doing his exercises at home. Okay. Would I be a good candidate for telehealth physical therapy? The short answer is really anyone is a good candidate for telehealth physical therapy visits, but they can be really helpful for people that have a compromised immune system and may want to continue to avoid larger groups of people, live a significant distance from a brick and mortar therapy location. We can use telehealth for the entirety of your care plan, or we can integrate that with in-person care, meaning that you can maybe have one visit a week where you're making it in person, and then supplement with one visit via telehealth so that you don't have to worry about commuting if you live a far distance from a brick and mortar location. You can receive care more frequently without having to always go to a location. If you have any difficulty with transportation to in-person visits, sometimes when you are earlier on in your rehab process, it's difficult to find someone who can give you a ride, or even driving itself can be uncomfortable to get yourself to a PT visit. This is a great way for you to get care without having to worry about transportation. It's a great way to continue some support with continuing to have some check-in points with your physical therapist without completely finishing off all of your visits. And then anyone who maybe has who travels more or has family commitments where maybe they're not always in the same location, it's wonderful for you to be able to access your physical therapist through a telehealth visit as well. All right. One of the big questions I get asked is, this sounds great, but is my insurance going to cover this? Almost all insurance plans now cover telehealth visits for physical therapy. There are a few insurance plans that might not cover it. Those seem to be very few and far between. At IBJI, and I would guess most other physical therapy locations, will actually verify your insurance benefits for you and let you know if your insurance plan does not cover telehealth visits. But I would say the plans that don't cover it are more of the exception rather than the rule. All right. What's the purpose? What do we do in a telehealth visit? Well, a full physical therapy or occupational therapy evaluation can be completed in a telehealth visit. That includes getting all of your medical history, the subjective history of your injury or your surgery. We can take measurements using devices that we can put on our screen where we can actually even measure how well that joint is moving. We can look at how you're moving in your home. We can look at the body mechanics that you're using when you're doing your day-to-day tasks, such as going from sitting to standing or even walking. We can use that information, put it together and create a plan of care for you, and then instruct you in exercises and a home program. We can go through them with you in your home environment so that we can help troubleshoot what is the best location for you to do this particular exercise. Is your mechanics correct when you're doing this exercise on your bed versus your couch? So there's a lot of value in a telehealth visit, especially as we're talking about getting you established on a plan of care, getting you exercises that will work well for you in your home. We also use a visit to just check in and monitor your pain level and your activity level. Are things progressing well for you? We can check in on how well you're doing your home exercise program, change it up, or give you more to continue to move you towards your goals and towards your rehab. We are there to then answer any questions you have related to your recovery, your symptoms, or your plan. We can also assist with communication with the physician care team if you have medical concerns. So we can sometimes be another point of contact for us to help coordinate care with all the stakeholders in your care, including your physician team. So how does a telehealth physical therapy visit work differently than an in-person visit? Well, obviously, there's no hands-on component. That's probably one of the biggest differences between an in-person visit and a telehealth visit. If we are working with a patient via telehealth and we note that there's a lot of stiffness or movement patterns that can't be corrected through just verbally instructing you or having you look at us and visually instruct you, then at that point, your telehealth therapist may recommend you transition to in-person visits. They can help determine this with you during your visit. The other thing that we really try to look at is your balance. You know, if you're challenged with your balance activities and you're unable to complete them on your own or with a family member, that's another time where your telehealth therapist may recommend that you transition to in-person visits. So you've decided, sounds like physical therapy via telehealth is right for me. I'm a good candidate and I'm comfortable with this idea. So how do I prepare for a physical therapy telehealth visit? First of all, the best thing to do is to try to familiarize yourself with the technology needed to log in prior to the appointment. Often, it is as easy as clicking on a link that will be sent to you in advance of your appointment. Make sure that you can connect with that link and reach out to your provider for any help doing so prior to the appointment. That would be what I would say would be one of the biggest hurdles that we navigate with some of our patients, is that they have a bit of trouble connecting through the technology. We usually will send a reminder with the link to your appointment 24 hours in advance. I often say, just try to click on that link and make sure your computer will navigate you through that. If not, then you can reach out to the front desk team at the clinic location, and they will help get you all set up so that you're not wasting any of your valuable therapy time during your appointment trying to get yourself squared away with the technology. Oftentimes a laptop or cell phone works the best because it's a little more portable and you can position it from different angles. And that you may need to do when you're working with your therapist, is to move your phone or your laptop to different angles so that we can see the different ways that you're moving within your home. Wear comfortable clothes. You will be moving around, so dress comfortably so that you can move into different positions and do different activities with your therapist. Make sure you have some good space. So you are going to want to set yourself up in a room where you have some space to move and maybe even be near a couch or a bed, because some of the things we may want to look at, we may want you laying on your back or on your side, and we don't need you to necessarily get on the floor to do that. And most important, ask questions. Don't be shy. We are here to help you and explain things to you. I would hazard to say one of the things the telehealth physical therapists enjoy the most about giving appointments or through this medium is that we have time, one-on-one time with the patient, that we can really get into explaining and educating. And we love questions. So we want you to make sure that you feel comfortable asking us questions. Okay. I'm going to go through and just give a few examples of some success stories we've had with different clients using telehealth physical therapy. So the first one I'm going to share with you, there was a 13-year-old who had a history of walking on their toes for many years. They started PT at IBJI due to more difficulty with walking, squatting, and participating in gym and track activities. This patient had attended therapy in the past, about a year or two prior to this round of therapy, but had difficulty attending sessions due to the parent schedule and the child schedule. Oftentimes, once we're talking about people who are in middle school, there is limited time after school for them to attend appointments, and most of the time that's taken up by other activities. So the patient and the patient's parent decided, let's try doing telehealth and see if this can allow us to get the care we need that fits into the busy schedules that we do have. This patient attended their first physical therapy, and the exam showed that they were missing motion in both ankles. They were missing ankle strength, and they had decreased ability to stand on one leg and keep their balance. That's unusual for a child that age. So already just with this exam, we were able to identify some areas where the patient had room to grow and could start to build a care plan for them just starting with that. The patient had a goal to be able to walk consistently without going up on to their toes, squat, and go to track practice without any difficulty. This patient is one of our patients that did a hybrid. So they did 1 time a week with telehealth and 1 time a week in the clinic. They attended 26 sessions, so they came quite a few times, but they were able now, because of this hybrid schedule, to be consistent with coming. Their telehealth visits really focused on progression of home program and reinforcing the correct performance activities for that patient in their home. Then the in-clinic sessions focused on more hands-on activities to improve patients' mechanics with the squatting, walking, and running. So put those together, and they were really able to support that patient well in both locations and help them get to their goal, which was by the end of the sessions, the patient had returned to being able to run track with improved form and less fatigue. So using this hybrid of in-person and telehealth, we got that patient back to doing what they wanted to do, which was be able to go to track practice and participate without being as tired and with good form. Another example I brought to share with you is we had a 63-year-old female who had a new onset of low back pain that went down the legs. This happened after lifting and moving boxes. The patient tried to manage her symptoms with Aleve and gentle stretching, but pain was worsening, so the doctor referred the patient to physical therapy. Patient had a busy work schedule, which made it difficult for her to get to an in-person IBJI location. The patient then opted to complete her PT sessions via telehealth. At the beginning of her course of care, the patient was most limited in bending forward, and pain worsened with sitting and standing for 15 minutes. Patient's pain was 8 out of 10 at the start of PT, and the patient was unable to golf or run. So patient's goals were to return to running and golf, to sit and stand for an hour without pain, to be able to function at work. So the first sessions with this patient focused on education, on best sitting and the best sitting posture in her home office, improved mechanics with daily tasks such as loading the dishwasher, getting in and out of bed, and doing laundry. The PT could see how the patient was doing this in her home and help her with correct positions to make these day-to-day tasks less painful. The first sessions also included gentle abdominal and hip strengthening exercises, as well as some easy stretches. The follow-up sessions included review of the previous exercises and progression of strengthening exercises in positions of standing, hands and knees, and sitting to improve back support in all those positions so that we could get her to the goal of being able to sit, stand, and do her daily activities bending without having the same level of pain that she was having. At discharge, when the patient was completed with her course of care, she had returned to golfing, could sit and stand for an hour or more without pain, and rated her pain at worst as a 2 out of 10 versus an 8 out of 10. So it was a very effective way for that patient to manage her pain and get back to living. And one more example, I worked with a 59-year-old male that had left and right knee pain and arthritis in both knees. The doctor referred the patient to physical therapy to manage the knee pain, but the patient lived with a family member with a compromised immune system and wanted to limit his contact with larger groups of people. So the patient elected to complete PT sessions via telehealth. We worked together for 12 sessions. At the start of the sessions, patient could not climb the stairs into the basement without pain, and getting up and down from a chair hurt both knees. Patient was rating their pain at about a 5 to 6 out of 10 at the first session. The exam revealed that there was decreased strength in both legs and hips, as well as decreased flexibility in both of his legs. The patient's goals were to be able to get up and down from a chair without pain to make workday easier, and to climb the basement stairs to complete laundry. So our first sessions together focused on mechanics with stepping up and down and training the patient to climb the stairs in his home with a different pattern to minimize the pain. We worked on adjusting the height of his seat, his chair for his office, and so that he could get up and down with less pain. And then we also worked on incorporating some gentle stretching and seated knee strengthening exercises to allow patient to begin making the legs stronger without pressure through the knees. Our following sessions progressed patient to standing exercises, including squatting with progressive level of difficulty, focusing on correct form, and allow the patient to sit and stand with decreased pain. At the end of our session, the patient was able to climb stairs into the basement with minimal to no pain and could get up from his desk chair with no difficulty. His pain was about a 1 to 2 out of 10 at the worst. So again, another way that telehealth provided a patient with a successful care plan and allowed him to get back to working and live in his daily life with much less pain. And that is pretty much it for my presentation.
All right. Well, thank you very much, Regina. That was really helpful. I have a few questions. We also have some questions that have come in. So we'll start with the questions that have come in.
Okay.
Could you do a demo? And I'm not sure you have the tool, but Meredith was wondering if you could do a demo of the tool that you use to measure range of motion on the computer screen.
So that actually is an extension that I pull up on the web.
Okay.
So I am not, I don't think I can do that right now. It's something that I usually do when I'm in my program doing the
Gotcha.
visit. I also just use, occasionally I'll just use a small goniometer and sometimes just measure up against the screen.
Okay. Cool.
Sorry, I should have been prepared for that, everybody.
No, that's okay. It's a good question. But it sounds like perhaps you could use the app to do the measuring, right? Is that right?
It's usually when I'm in the appointment with the patient, I've pulled up, I'm on my Chrome and can navigate to that.
Gotcha.
Add on that extension. I feel like I could probably try to pull it up, but you'd see a lot of fumbling before I was able to do that.
Fair enough. Fair enough. No, thank you. Meredith also says, what about MMT? And I'm sorry, I don't know what MMT is.
Meredith, I believe you're asking about manual muscle testing. That means that oftentimes when you're in an in-person visit, your therapist will have you say, put your arm out, and I would resist it. And then I would be able to grade your strength from doing that. So one of the ways that we work on that is, first of all, we just see, can you reach your arm, say, through a full range of motion? Well, then you've got at least 3 out of 5 strength. Sometimes if we really want to get into, especially maybe teasing out what muscle group may be giving us a little bit more trouble, we may have you as the patient do some of that manual muscle testing with us. So let's say I want to test how strong your reach forward is. I'll say, okay, Meredith, will you please put your arm out? Now I want you to push up into your arm. What's happening? Are you getting pain? Is there weakness? So I start to see a poor movement pattern. Then I can use some of that information to grade a little bit more into the manual muscle test, but more importantly, look at the quality of motion and see what's happening, because that's almost as informative as anything else.
Awesome. That makes a lot of sense. Okay, I'm getting questions from everywhere. I've got one on my phone via text. How long is normal to continue treatment with a physical therapist? And I'll ask you, like, not just in person, but also via telehealth? What is a typical range of length for the time that one would spend with a therapist?
Okay, that's a broad question, and a lot of it is based on what you're coming to therapy for. So most of the time, like if you're in person, say you're coming for maybe some low back pain that you've had for 6 months to a year, we would expect that maybe you would be working in person, maybe 4 to 6 weeks, somewhere between 8 and 10 visits, maybe. But of course, that's all dependent on what's happening with the person. But oftentimes, physical therapy is sort of meant to get you to rehabilitate you to a level where you can function in your daily life, but you may not be all the way to 100% perfect. You'll have a care plan, a home exercise program, you'll continue doing it at home. With some of these programs that we're running, if you're using the app, well, that app is functional for you for up to a year after you start. So you can continue to use the app and track your exercises with me. Does that mean you're going to directly interact with me? No, but if you have a question, can you put a question in the app and can I see it and respond to that? Absolutely. So what it does is it takes sort of this paradigm that we have that you should have so many weeks of in-person care, and it allows us to extend that. Another thing that we can do too is, hey, it's about time for you to be wrapping up, but you're not 100% sure that this care plan, this home exercise program, is going to manage your symptoms well once you're not coming. So sometimes I just had a patient today that was ready to try things on his own, but he was not quite ready to be fully done with formal therapy. So what I said is, hey, let's make a telehealth visit in 3 weeks. You and I will meet. We'll go over, we'll make sure that you're still doing the exercises. We'll make sure that you're still doing them with good form. If they're easy, I can give you some new ones. And we can really make sure that you've gotten back into your daily life and that the exercises are enough to manage your symptoms as you sort of transition back into the world, if you will.
Awesome, awesome. And you mentioned being able to keep track of your exercise plan on the app. I think that's a really beneficial thing because people often come home with pieces of paper that then get lost. But in the app, and they can keep track in the app, so they will fill in, I did these exercises today, so you can see what they're doing?
Absolutely. So in the app that we have that's integrated with our EMR, our medical records, our electronic medical record system, you have the ability, so you'll pull up your exercise, you can click yes that I did it, you can even rate it. Today felt easy, today felt hard, today felt painful. And then there's even a little box for you to put in a message saying, this is how this one's feeling today. Is that right? I get that message on my computer screen and I can just message you back. So awesome. It's very interactive, if you want to engage in and use it.
And can you send like a picture of the exercise to the patient via the app?
Yeah, yep. All the exercises have pictures, instructions. Some of them will even have videos, so awesome. That they can reference that to make sure that they're understanding how to do the exercise as well.
Great, that makes sense. All right, Deb asks, would telehealth PT work after shoulder surgery?
Yes, it will. Yes.
Excellent.
Now again, that could be one where maybe that hybrid is the best option for you. That would be something where you could meet with your telehealth therapist and then he or she could assess how you're doing after the surgery. Most of the time, if you're really acutely post-surgical, we'll probably have you be in the clinic because there is a certain amount of stretching and gentle hands-on component you would need. But if you're further out post-surgery or you want to start to do a hybrid type of thing where you're like, you know what, I don't need as much hands-on.
Yeah.
I now just need to figure out how to use my arm more in my daily life. You can certainly then maybe do a hybrid where you're going up once in person and then once via telehealth, and then again kind of using the app and or that ability to check back in with your therapist via telehealth to kind of keep that support for you as you are kind of finishing up that traditional therapy.
And can you wean off of that traditional therapy? Let's say first it's once a week you go to in-person and once a week you do telehealth, and then maybe a few weeks later it's every other week you do an in-person, but you're still doing telehealth in between. It doesn't have to be a once a week kind of thing.
No, what some of the beauty of this is we're just kind of starting to discover the power of it and the flexibility of it and
Yeah,
how to use it. Every person's a little bit different. So what's going to be the way that you feel best supported as you kind of continue to take all the things that you've learned and all the exercises you now know and apply them in your daily life. So there's all sorts of different ways that we could use this platform to help support you as the patient in whatever way seems to work best for you and your schedule.
awesome, awesome. That is great. Ashley asks, do any of your hand therapists do telehealth occupational therapy?
Not as of yet. We don't have any occupational therapists who are dedicated telehealth therapists at this time, although we are gauging the need for that and are assessing when we might be able to offer that as well.
Great, and it sounds like maybe there's an interest.
Yes. If you have interest, please let me know, everybody.
Yes, for sure, for sure. All right. So I asked if the telehealth app tracked workouts. How can you get range of motion for any particular post-surgery by using telehealth? So maybe Andrew came in on a little bit late because you talked about how you can measure, but maybe you could explain it again for him.
Let me just show you as a nice example. So if I was the patient and I said, okay, please show me how well your arm moves. You could go like that. Now I could take on my screen, I could have a little goniometer, or if I'm just being not even that fancy, I could have you go like this and I could take a measurement of that angle I can see on my screen. When I have a bigger screen, I have a better ability to kind of see the full, I can actually measure a little bit better. So that's, that we can take those measurements, same with the legs, but that's usually what we do. One of those two things, like I said, that extension where I can pull the goniometer up on my screen, or just use a smaller one and measure what you can show me as the patient on the screen.
That's really cool. Excellent, excellent. Thank you. Can people use, you mentioned using a laptop or a phone. How about their iPad or another type of tablet? Is that something they could use?
They can. The biggest issue with a tablet is that unless you have something that's easy, like a stand that comes with the tablet that you can use to prop it up, that can make it challenging. And sometimes that tablet doesn't have as much ability, even that little stand that they have doesn't allow for as much changes in the angles or propping it in certain ways that allows your therapist to see everything as best as they could. You certainly can use the tablet, but we found that phones and laptops are just a little bit easier for people to utilize.
Got it. That makes sense. Thank you. Thank you. How about if someone needed to travel? Could they still do their telehealth appointments if they had to go to Arizona to visit their mother?
So for short periods of time, yes. Now, if you were saying, I'm now going to go stay in another state for 2 months, then currently we can't continue to see you for that full time.
And is that a law, not a telehealth thing?
Yeah, that has a lot more to do with the different licensure rules state to state and some Medicare requirements as well. So,
okay.
Yeah.
So if they were to visit their mother in Southern Illinois, it would be okay.
Sure thing.
For a couple of months. But if they went for short periods, if they had to go, do something, right, they could do that.
Yeah, let's say they're on a business trip, or they're going out to help, a family member for a week, then we can certainly work within those parameters. Mm-hmm.
Awesome. Oh, that's great. Good, good. Can you really see what somebody's doing? It's two-dimensional. Can you really see what somebody's doing in telehealth well enough to be able to provide them physical therapy?
Yeah, and if there's something that's happening that we are not getting success with how we're delivering our care through telehealth, then we might say, you know what? This might be a great time for you to step into seeing a clinician in person, at least for a couple of visits, to make sure that we're able to really see and address everything that's going on.
Great, great. All right, we got another question. And let me see, an in-person therapist can move your affected area of post-surgery more than what an individual could do. But so I think what they're saying is if you're in person, your therapist can move you, like you were talking about the MMT. So that is probably true. The therapist can help you to move a joint, let's say if you're working on increasing your range of motion. Yeah. But I guess you also have ways where they could maybe help themselves.
Exactly. Yeah. And again, this, for our patients that are acutely post-surgical, like within the first few weeks, this may not be the best option for you. We have had a few people that, because the choice was either do it telehealth or being unable to access care, we would of course prefer telehealth, right? But for these, there are certain situations where you are probably going to be better served to do in-person visits. And we can always help determine that. Even if we start with telehealth, that does not, sometimes we can start with a visit or two, then transition you into the clinic. Like I said, there's a lovely amount of flexibility in this delivery, in this care delivery platform, that really, hopefully our goal is to really increase access to care, make it easier for patients to get the care they need, and to identify where that care location might even be best.
Yeah, yeah. And that I think is one of the coolest things that people may not realize, is that someone may have a choice of either no physical therapy or telehealth. And to have that option and really be able to see a physical therapist virtually is an amazing asset to what you're able to provide in care.
Yeah, that's one of the studies they've been doing is how, this has allowed, especially, if we live in the Chicago area, we're not, it's the travel or the commute. Well, depends on where you are and what day it is. But
Yeah.
there are more rural communities as well that really there aren't a lot of choices, or there's a lot of traveling to just get to a location where you might be able to access care. And I love the idea that we may be able to extend care further out by using this platform.
Yeah, which is really great. What is your favorite thing about telehealth with your patients?
I really love that I can, just talk with them one-on-one. In a clinic, I spend a lot of one-on-one time with my patients, but there's a lot of other things happening around. Usually when I'm doing a telehealth visit, it allows me to really zero in and work with the patient. I also love to see what people are doing in their homes. I mean, I love when you all come to see me in person, but really you live your life in home or at work. I have done some appointments with the patient when they're at work and kind of help them set up their desk situation. But that's going to be a really helpful way for us to know, are our interventions really helping? And if I see how well you're doing it in your real life, then I can make sure that I'm teaching you in a way that's actually most productive for you.
Yeah, like you mentioned, you can see how someone bends down to the dryer and empties the dishwasher and does those things, and you can give them like true, real-time guidance as to how to do those things properly and safely and to become pain-free. I love that. And I suppose at work you could teach someone how to sit at their desk or stand at their desk or whatever.
Yeah. Yeah. A lot of times people will say, well, all I'm doing is sitting at my desk. And then they show me how their setup is. And I'm like, well, your back is probably hurting because you spend all day sort of turned this way because that's how you've set yourself up. Let's see if we can get you better situated and see if that helps you.
That is great. And are you finding that people are adhering more to their exercise plans when they have the benefit of the app and the ability to keep track? Are you seeing people adhering better?
I feel like, yeah. I mean, I can literally track them because I can pull up at any time anyone who's on the app, and I can look to see if they're, checking in and doing it. But I can also, I do think that people like the idea, and they're engaging more. They're asking me questions. They're like, hey, today this exercise felt like this, but yesterday it felt like this. Is that normal? So I feel like they really are also understanding how things should feel when they're at home. I think sometimes it's like you come into a session and then maybe you come see me on a Thursday and you don't see me again till Tuesday. And it gives you a few days, like, I don't want you to be feeling like, is this right? Is this normal? So it really helps people feel like if I can ask that question, then I feel really comfortable knowing that I'm doing this right.
Because it gives them a level of accessibility that they just don't have if they're only doing in-person physical therapy.
Yeah, and like I said, it's like a great supplement because I think that telehealth has a lot of great applications, but I am an in-clinic therapist, for most of my day. So I know that there's also places for that. And so I think there's a lot of great ways that we can use these different mediums to actually extend the care and to help patients bring that, what they're learning in the clinic or on their computer, even more so out into day-to-day life.
Oh, that's awesome. Well, that is everything, everybody. Those are all the questions that have come through, unless there's some parting wisdom that you want to give, Regina, to people with regard to telehealth. My thought would be, don't be afraid to give it a try. It seems like it's really an option that is really viable and very beneficial to people. Do you have any parting words for folks?
Yes, I say give it a try. And the number one thing that I hear is people are like, you know what? It's just normal to have pain. No, no. So people are like, I'm aging. I'm just going to have pain. That's not true. There's always a great way to, get some information, get some assessment. There's oftentimes a lot that you can do to help yourself move out of pain.
Awesome. All right. On that note, Regina Roderick, thank you so much for your time and the effort that you put into this wonderful program this evening. Thank you to all of our attendees. I hope you learned a lot tonight, and I hope that you will take advantage of telehealth through Regina and physical therapy at Illinois Bone and Joint Institute.
Thank you so much.